Hi, I want to ask you a question. When you go and see your doctor or any other healthcare practitioner, are you seeking disease care or are you seeking health care? Now, the answer to this is going to be very intriguing and you may never have heard it in this manner. So watch out till the end of this video and I'm sure you will find a ton of value in this video. Hi, my name is Dr. Arun Dhir. I'm a gastrointestinal and a weight loss surgeon. I'm also a yoga and a meditation teacher. And I truly believe in the state of peak health and vitality, and that the mind and the body and the gut have to all line up together and be in harmony and balance. I'm going to present to you today a model of health and well-being, and I'm sure this will resonate with you as it has done for many years that I've been talking about this model to many of my patients who come to see me. And remember this, people who come to see a surgeon are generally coming to see a surgeon as the last resort. No one wants to just come and show up and see a surgeon and get under the surgeon's knife because it is painful, it is risky, and it can be expensive. So let's get straight into it. So today I'm going to be presenting the model of what is healthcare and what is disease care. See, as medical practitioners, we provide care in the hospitals, in the clinics, and all of that. Now, to be honest, we are not providing health care. We are providing disease care. We want you to be sick for you to be able to come to us. We want you to have a diagnosis, an illness, a sickness, so you can get a prescription for a pill or you can sign up for a procedure. That is called disease care. That is not health care. And listen to this because I'm sure it will resonate with you. The way I present the difference between disease care and health care, I'm going to be presenting in this flip chart, and I've drawn two trees to make this a very good analogy for you to be able to understand. The one on the left is I've taken the example of weight issues or obesity, which is such a common problem in our society. When we talk about obesity, if you look at this tree over here, there are problems associated with being overweight, such as high blood pressure, fatty liver, joint issues, back issues, gut-related issues including gastroesophageal reflux. People have sleep apnea, which they ignore because they think snoring is normal. Then PCOS, which is also a condition which can lead to gestational diabetes in pregnant women and also certain amounts of cancers. Now, people try and do band-aid treatments with pills. They go and take a prescription for joint pain, such as painkillers. For fatty liver, they're generally told there is nothing that can be done about fatty liver. Then for gut issues, they take medications such as Nexium and Somac. But all of this is stemming from being overweight. Please understand that the tree of sickness, which is got, I've put only branches with hardly any green leaves, which represent energy and vitality, is there are hardly any green leaves because they're tired most of the time. So then what they do, they try and treat obesity with diets, medications that suppress appetite, or weight loss surgery. So what do? You try and cut the tree at its trunk. But they forget that there are roots and that can grow back again. Now this is the important thing, that the roots are under the ground. They are in the mind because they are not visible. They are subconscious. What is above the ground is the body. It is conscious. You are aware of it. You can get the diagnosis. But what is below the ground is the roots. And what are the roots made of? This is interesting. Fear, anxiety, worry, blame, shame and guilt, and truckloads of other negative emotions that we carry as a baggage. Now, unless those roots are taken out, that tree, that weed, that unhealthy tree is going to keep coming back. Now, let's shift the model to that of healthcare. Healthcare is a state where there are these 5 key things that I talk about in the tree of health and wellness. Is number 1, energy. A person who's healthy has got a lot of energy to do things. Number 2, a person who's healthy has got clarity of thought. The opposite of clarity, what a lot of people who are unhealthy have, is brain fog. Then people who are healthy have also got resilience. By resilience, what I mean is they have the ability to bounce back. Then people who are healthy have got initiative. And lastly, and most importantly, they have creativity. Now, a healthy person that you may think is healthy may not have all of these qualities, but this is how I define peak health and vitality. The roots of that tree of health is made up of mental attributes like courage, confidence, the ability to trust, and very importantly, it all starts with the awareness, which means awareness of what is good for your body and what is not good for your body. So I want you to look at this model of healthcare on one side and disease care on other side, and try and see what can you pick up from this holistic approach, and try and transition from disease care to healthcare in knowledge. Don't do it like, tomorrow I'm going to stop all my medications. I'm not going to take anything. Now that is where you need to get true, valid information. Change starts with information and then has to be backed up with the second thing, which is called action. Information by itself is useless. You need information on which you can take action, and that is how you transition from disease care to health care. Do not stop any treatments just by watching one video. That is not a safe way to do it. Do it in a measured, safe manner, and your treating practitioners would say to you that you probably do not need the cholesterol lowering medications because your cholesterol is naturally getting better. You do not need blood pressure medication because your blood pressure begins to come down. So it's a measured approach transitioning from disease care to health care. If you like this video, do share it with your friends and family, because when we grow collectively, we create a change on the planet.